Let me do it again. Nuestro próximo presentador es Dianne Figlewicz Lattemann, and she's going to talk about what is type 2 diabetes, en español, que es diabetes del tipo 2.
Thank you. It's really a pleasure to have an opportunity to be here and to be part of the second annual Yakima Valley Science and Engineering Festival. And I want to start by particularly thanking Dr. Lydia Aguilar-Bryan, who gave me a little help with the translations. Estoy muy contenta de estar aquí y hablar con ustedes sobre qué es la diabetes. What is diabetes? Diabetes is a disorder characterized by high sugar or glucose levels in the blood that will affect, in the next few years, 300 million people. When glucose or sugar levels are high in the blood, they may or may not give you symptoms, which is a problem because then you don't have a way of knowing that you're sick. If you come from a family that has diabetes, you are at a greater risk to have the disease. La diabetes es una enfermedad que se caracteriza por niveles altos de azúcar o glucosa en la sangre y afectará en los próximos años 300 millones de personas. Cuando el azúcar en la sangre está alta, puede o no dar síntomas de enfermedad, lo que es un problema porque entonces no podemos saber que estamos enfermos. Si uno está de una familia que tiene diabetes, tiene un mayor riesgo de padecer la enfermedad. ¿Quién de ustedes viene de una familia con diabetes? Yo también tengo tías y un tío y también primas. Es muy común. This is a slide taken from the Centers for Disease Control website where they track the incidence of diseases in the United States, such as diabetes. And here they're showing the incidence of diabetes between 1958 and 2010. And you can see that whether you look at this as a percentage of the overall population or you look at the actual numbers of people with diabetes, there's been an enormous steep increase in diabetes incidence in the last 15 years, since 1997 or so. Oops, go back. Aquí ustedes pueden ver la tendencia para la diabetes para aumentar dramáticamente por los 15 años pasados. Here in this graph, there's the relative incidence of diabetes shown for each individual state in the year 2010, and this is diabetes among adults. And so if you look at Washington State overall, you see that the incidence overall in Washington State is somewhere between 6 and 7%. En todo el estado de Washington, el frecuencia medio era 6 o 7%. But when you look within the individual counties within the states, the Yakima County, in fact, has a higher incidence, somewhere around 8 to 9%. And this is a graph from 2007. Now in 2012, the incidence in Yakima County is around 10%. En Yakima County, la incidencia fue 8 o 9% en 2007 y hoy está cerca de 10%. Coming back to talking about the disease, how are normal glucose levels maintained? They're maintained by the hormone insulin, which is the only hormone in the body that can lower glucose levels. Insulin is made in what are called the islets of Langerhans or the pancreatic islets. So the pancreas is that long, stretchy gland shown in the diagram there. It's close to the small intestine and close to the liver. And within the pancreas are little balls or clusters of cells that are known as the pancreatic islets, and it's these cells that produce insulin. In the most common form of diabetes, type 2, the islets get tired of making insulin, and they fail little by little. In the less common form of diabetes, type 1, the insulin-producing cells are killed by the body, and there is no other cell in the body that can produce the hormone. The result is that glucose or sugar levels in the blood will rise and lead to diabetes. ¿Cómo se mantienen los niveles normales de azúcar? La insulina es la única hormona que puede bajar los niveles de azúcar en la sangre y se produce en las células beta de los islotes de Langerhans. Los islotes se encuentran dentro del páncreas por la figura, y dentro de estos pequeños islotes hay células especiales, se llaman células beta, que producen la insulina. Estas células son las únicas células por el cuerpo que pueden producir insulina. En la forma más común de diabetes tipo 2, las células beta del páncreas se cansan de producir insulina hasta que hacen tan poquita que no tiene ningún efecto. En la forma menos común de diabetes tipo 1, el cuerpo destruye las células beta y entonces no hay nadie más que pueda producir la insulina, lo que resulta en niveles altos de azúcar, diabetes. Aunque la diabetes tipo 2 afecta principalmente a adultos, ahora tenemos una epidemia en la que gente más joven padece de la enfermedad también. How does insulin work and why is it so important? Insulin's major action is to take nutrients out of the blood and get them into the tissues or organs of the body where they're used as an energy source or they're stored. And this includes, to a large extent, glucose or sugar. And the key organs that are require insulin for this are the liver, muscle cells, and fat cells. La insulina actúa como el portero, quien le indica a las células cuándo tomar los diferentes nutrientes para que no se queden circulando de la sangre. Uno no puede vivir sin insulina, así que una vez que se acaba la insulina natural, hay que tomar insulina sintética. Una parte de la diabetes tipo 2 es las células beta. Una otra parte se llama insulin resistance o resistencia a la insulina. Sometimes we make some insulin, but the insulin is not able to act. It's ineffective at getting the blood glucose into the liver, the fat cells, or the muscle cells. En la resistencia a la insulina, esto no funciona y el hígado, músculo y grasa no pueden utilizar el azúcar, la cual se queda en la circulación y los niveles se elevan. What kind of damage is produced when glucose levels are high? ¿Qué tipo de daño se produce cuando los niveles de azúcar están altos? When glucose in the blood is too high for too long, it damages many different parts of the body, including the eyes, blood vessels, and this is large blood vessels in the body as well as smaller blood vessels, and particularly the blood vessels in the heart and kidney are targets, and nerves, particularly the nerves to the extremities, the hands and the feet, so that patients don't feel pain or temperature changes in the skin. Cuando el azúcar en la sangre está alta por mucho tiempo, causa un daño importante en varias partes del cuerpo, incluyendo los ojos, La diabetes es la principal causa de segura en adultos. Los vasos sanguíneos, particularmente corazón y riñón, y los nervios. El paciente no siente dolor o cambios de temperatura en la piel. Las personas con diabetes tienen el doble de probabilidades de desarrollar enfermedad cardíaca que alguien que no tiene diabetes. También, la diabetes es una de las principales causas de insuficiencia renal. Los nervios daños y vasos sanguíneos daños hacen problemas por los pies. Algunas veces, el paciente puede perder una o ambos pies y entonces el paciente puede perder uno o ambos de la pierna debajo de la rodilla. Todos de estos problemas son causados por el azúcar alta. Y hay otros sitios que son importantes, por ejemplo, la boca y también los dientes. What are the most important factors that influence the appearance or risk for diabetes? ¿Cuáles son los factores que determinan la aparición o incrementan nuestro riesgo de tener diabetes? Primero, herencia, inheritance. We know that diabetes occurs in families, but we do not understand yet exactly how this happens. Sabemos que la diabetes ocurre en familias, pero no queda claro por qué. No sabemos por qué. Also important, environment and lifestyle. This can either contribute to the development of the disease or it can help prevent it. Exercise is extremely important, and we just heard a talk about this. Exercise acts by mimicking the action of insulin, by increasing sugar entry into the muscle. So when we use our muscles, when we're doing work, we need energy, and we take up glucose from the blood to provide energy for our work. And when we have a regular exercise habit, what we'd call trained muscles, our muscles actually develop mechanisms to more efficiently take up sugar from the blood. And this is a process that does not require insulin. Also, when the muscle is trained, when it's used to working, it's more efficient at taking up forms of fat out of the blood, so we have less fat circulating in the blood, and also we're storing less fat. Diet is very important. A diet that is too high in fat or certain sugars, particularly fructose, can actually act to make the beta cells sick. El estilo de vida también tiene un papel principal por el desarrollo o la prevención de la diabetes tipo 2. Ejercicio imita la función de la insulina porque estimula la entrada de glucosa al músculo en ausencia de insulina. Las grasas se utilizan de una manera más eficiente y se acumula mucho menos. La gente que viene de una familia que tiene diabetes puede prevenir su aparición haciendo ejercicio moderado por 30 minutos cada día. Solamente 30 minutos, no es mucho. Y moderado, como caminar a buen paso. La dieta también es importante. La dieta para una paciente que tiene diabetes no es muy diferente de la que come una persona que no tiene diabetes. Hay que comer menos grasa y azúcares y, al igual que el no diabético, tomar porciones pequeñas. Fat and sugar in the blood make the beta cells sick. We call this beta cell toxicity. Grasas y azúcares en la sangre enferman a las células beta. Se llama toxicidad de las células beta. Sick beta cells that make insufficient insulin combined with insulin resistance in the liver and the fat and muscle equal type 2 diabetes. Las células beta enfermas que no pueden producir insulina y resistencia a la insulina por el hígado, la grasa, el músculo, igual diabetes tipo 2. What medicines do people with diabetes take, and how do they work? Medicines can be taken by mouth, we call them oral agents, or injected, like insulin. Most individuals with type 2 diabetes begin by taking oral agents, and these can act either by increasing sensitivity for the insulin that they're making, so less insulin resistance. Others stimulate the beta cell to produce more insulin. For type 1 diabetes, all patients must take insulin because their beta cells have been destroyed and they can't make their own insulin. For type 2 diabetes, patients require insulin as the disease progresses. Las medicinas se pueden tomar por la boca, se llaman oral agents o inyectadas como la insulina. Algunas medicinas aumentan la sensibilidad a la insulina, menos de resistencia en el músculo y la grasa. Otras estimulan a la célula beta para que haga más insulina. En la diabetes tipo 1, todos los pacientes requieren insulina porque las células beta fueron destruidas. En la diabetes tipo 2, el paciente empieza con pastillas y cuando la enfermedad empeora, es necesario usar insulina. The most important thing to know is that most patients can control their diabetes with good diet and exercise. Es muy importante saber que la mayoría de los diabéticos se pueden controlarlo con una buena dieta y ejercicio. Pero todos sabemos lo difícil que esto es, porque se requiere de una gran disciplina y el apoyo de nuestras familias y amigos. How do I know if I have type 2 diabetes? ¿Cómo reconozco si tengo la diabetes tipo 2? The key symptoms of diabetes may develop slowly. Los síntomas se desarrollan lentamente y incluyen, se llaman las 3 P's. Poliphagia, tiene mucha hambre. Polydipsia, tiene mucha sed. Y poliuria. Y hay otros, excessive tiredness, fatiga, y llagas o cortadas que no cicatrizan rápidamente o infecciones frecuentes, slow healing sores or cuts or frequent infections. What can I do? If there's someone in your family with diabetes, talk with your parents or with your family about your diet. Have your blood sugar tested and find a form of exercise that ideally you like or at the very least tolerate so that you'll do it on a regular basis. And remember, you don't have to do it alone. Team up with family members or friends or neighbors, share a healthy meal, or go for walks. ¿Qué puedo hacer si usted tiene alguien en su familia que sufre de diabetes? Hable con sus padres o su familia de su dieta. Es importante verificar los niveles de azúcar en sangre, muy importante, y ejercicio. Y usted no tiene que hacerlo solo. Forme un grupo con su familia, amigos o vecinos. Comparte una comida sana o vaya para paseos. Y hay ayuda aquí, Centros para el Control y la Prevención de Enfermedades. Tiene una página por español aquí, cdc.gov/diabetes/Spanish, es por español. Los costos de la diabetes para el individuo, calidad de vida o costo monetario son extremos. Por esta razón es importante para prevenir su desarrollo o para controlarlo bien si desarrolla. Thank you very much. I'm happy to take any questions, or you can email me at my email address with the subject line Yakima Valley Science Festival. Muchas gracias. ¿Hay preguntas de ustedes? So polyuria means you're going to the bathroom a lot. And this has to do with the fact that when glucose goes through your kidneys, it starts to spill into the urine and it pulls water out of the body with it. This is also what makes the thirst. So you're going to the bathroom more, and that secondarily makes you very thirsty, and you see it's sort of a vicious cycle because then you're drinking more water, but you're still going to have high levels of sugar in the blood. So unless you're controlling the levels of sugar in the blood, you're going to have both of those things going on at the same time. And I can't translate that. Yes, actually, I forgot to mention, so the type 1 disease happens very quickly because the beta cells are killed, and this can happen in weeks or maybe a few months. And the symptoms then are very dramatic because they come on so fast. In type 2 diabetes, it takes much longer period of time. It may be a period of years while the beta cells are getting killed off, and so you're not even paying attention. And suddenly, one day you go to the doctor for some other reason and you find out that your blood sugar is very high. And so I think what's important is for people to realize, to sort of be tuned into themselves and realize that these symptoms may be happening, to go back and think about a year ago, 5 years ago, something like that. But they're basically the same symptoms because they're caused by the same reason, which is the high blood sugar levels. There's a lot of research being done, and it's a little bit too complex to talk about in this type of talk. So type 2 diabetes has had a lot of genetic work done, and we know that there are a large number of genes, I want to say 60-some, 80-some, maybe Maureen knows off the top of her head, that are found associated with diabetes in families. And some of them sort of make sense because they have to do with metabolism, and some of them we have no idea why they show up as sort of markers. And it's not straightforward the way you have blue eyes or brown hair or blonde hair, that sort of thing. It's probably what we call a polygenic disease, so you have a cluster of some of these genes change, and that just somehow or other increases the risk for diabetes to happen.
Could it also be that, obesity gene?
There are definitely some obesity genes that are part of the risk set, yes.
What's your belief on the damage that diabetes causes? Can it be reversed? And I say that a lot of times people are diabetic and they don't know it until years later maybe. And so some people say, well then, if I already have this damage, I'm not going to control my diet, I'm not going to look at exercise because the damage is done. My diagnosis is in, let me just live my life. I have no incentive now to take care of myself.
Well, I would say that's a rather negative self-attitude. Certainly there's very dramatic examples of what happens with diabetes. Not taking care of blood sugar means you can go blind. You can go blind because you damage your eyes, or you will start having sensory problems with the nerves. So I think, sort of like what Cynthia was talking about, I think education is really important because you realize that even though you can't see what's going on, it's doing the damage, and the damage will show up.
You know, the crazy thing is that Latino families, we have a hard time going to the doctor because it's only like in an emergency state.
Mm-hmm.
Like, and so it is about education and really
Yeah.
preventative.
Yes. And, really, and I think also sharing. I mean, again, I think community is important, and whatever dialogue you can generate within your family is good, with your friends and neighbors, at schools, that sort of thing. I think just to sort of get the groundswell of conversation about it up a little bit, because there are lots of resources. The American Diabetes Association's wonderful, of course.
Just out of curiosity, can you tell me how much it costs for dialysis?
Oh my gosh. There was actually an article about dialysis decisions in the Seattle Times. I am trying to think if it was in 2013. You might be able to look this up because they had numbers. It was an article about early decision making about who should or shouldn't go on dialysis, because the original idea was the machines were so rare that people who were very, very sick were basically not being put on the machines, and there were ethical issues. So I think if you search in the Seattle Times, I think it was sometime within the last few months, 3 months or 6 months, and it was in the Sunday paper.
How much do doctors realistically emphasize the importance of nutrition for somebody who may want to prevent diabetes or already has diabetes? Which I don't think is very common, and what is being done for doctors to emphasize that a little bit more on different medicines and treatments?
I can't really speak to that because I'm not a medical doctor. I would say my impression is there's been a bit of a barrier in general for conventional medical practice to just turn to talking about nutrition, and I think that dialogue has to change. And it helps, I think, that there are a lot more alternative health providers that are just there at the regular visit. Like I think a physician assistant comes and interviews me first and takes my weight and blood pressure and chats with me for a few minutes before the doctor comes in, and I think that's starting to get into regular practice a little bit more. And so, once again, I think that there has to be a little bit of a groundswell of talk about that, because when I was growing up, there used to be this kind of hokey expression, you are what you eat, and it's really true.